Good afternoon, everyone, and thank you for attending this press conference being put on by the New York State Center for Clean Water Technology, which is housed at Stony Brook University. We have some important announcements to make today regarding two recent discoveries and publications by the New York State Center for Clean Water Technology, and some very relevant and important information for clean water on Long Island. To start, I'm going to introduce Adrian Esposito. She is the Executive Director of the Citizens Campaign for the Environment, clearly a leader for clean water on Long Island, and I'm going to give her the opportunity to give some comments about the new discoveries we're going to describe today. So Adrian, if you would.
Sure, thank you so much, Chris. As Chris said, my name is Adrian Esposito, Executive Director of Citizens Campaign for the Environment. We are beyond thrilled with the science that will be released today. It validates all of the work that has been going on for the last 4 years regarding 1,4-dioxane in household products and their contribution to drinking water quality and degrading our drinking water supplies. One of the things that led us to do the test of common household products in 2017 was this sporadic results of drinking water having not the high levels of 1,4-dioxane that would be produced by industry, but rather lower levels, but still significant levels that would come from a different source. And that led to the testing of 80 different household products, where we found 80% of those products have 1,4-dioxane in them in very high levels in many cases. The highest level was 17,000 parts per billion. I'm sure you're all aware that the New York State drinking water standard, as of last year, is 1 part per billion. So many have asked me, when will that legislation that was passed to ban 1,4-dioxane from products go into full effect? It goes into full effect by December 2024. So the issue right now for us is, how do we protect Long Island's drinking water? How do we keep the public safe? And we are really excited that Dr. Chris Gobler and his team and the folks at Stony Brook University are really now leading the charge with revealing science that allows us to make even greater public policy. One thing I want to point out is this kind of documentation also necessitates us to, or the state DEC, to test wastewater in such things as laundromats, car washes. Those are another potential, or based on the science, probable cause of 1,4-dioxane entering into groundwater and also surface water systems. So there's a lot to be done, but this science allows us to make even more strides forward. So we're very excited about that. We're very thankful for Stony Brook and the work that they're doing on clean water and science-based work to allow us to attain clean water. So thank you very much, Dr. Gobler.
Thank you so much, Adrian. Very much appreciated. I'd now like to introduce Kevin McDonald from the Nature Conservancy. The Nature Conservancy have been leaders in advocating for upgrading septic systems across Suffolk County and across Long Island, and leaders in advocating for cleaning up groundwater in order to protect surface waters. And Kevin McDonald has been at the front of that charge, and we're honored to have him here to share with us a few words. Kevin, if you would.
Chris, thank you very much. It's a pleasure to be here. And we at the Nature Conservancy have been heavily invested in water quality improvement, bays and harbors in particular. And we know full well from the work that's been done by the Long Island Nitrogen Action Plan, which was an initiative of the governor and the state legislature, Fred Thiel and Steve Engelbright, Ken LaValle in particular, that the big question asked was, we know we have a problem and we have to do something about it. And an early investment made by the governor with the Center for Clean Water Technology, which didn't exist until there was an acknowledgement that we needed to do something different, and we needed different thinking, and that the systems in place were responsible for the problems we now have, which is what Adrian just alluded to. So, you know, the academic arena was charged by the governor and the legislature at Stony Brook University, creating a new Center for Clean Water Technology, and basically told, go solve all these problems that we don't have solutions for, but we have to now deal with because of, quite frankly, a failed water delivery, procurement, and protection system. And I'm pleased to hear one more update from the Center for Clean Water Technology. I look forward to being tired of hearing their successes. And, you know, a critical dimension of the work that they're doing with some of their technology investigation is further reductions of nitrogen contamination. And all of that is really terrific because it's creating basically a new ecosystem where the academic arena is informing the commercial development of alternatives. It's coordinated with the regulatory and policy-making arena to answer the question, if we were to do two things differently to improve water quality, how would we do that? And is the technology and the science available? And I think we're about to hear the answer is, one more time, from the local guys, yes. Thank you.
Thank you so much, Kevin. Very much appreciated. To start off the scientific program, I'm going to introduce Dr. Arjun Venkatesan. Dr. Venkatesan came to us from Arizona State University, and his leadership in thinking about how we can best protect Long Island's drinking water and remove contaminants from our drinking water has been invaluable for the center and ensuring that we've got a clean water supply for this island. So with that, I'm going to turn it over to Dr. Venkatesan, who's going to talk about part of our first discovery. Arjun, go ahead.
All right. Thank you, Chris, and good afternoon, everyone, and thanks for attending this event. And so my name is Arjun Venkatesan. I'm the Associate Director for Drinking Water Initiatives at the New York State Center for Clean Water Technology. Our group has been working on the topic related to 1,4-dioxane for over 3 years now. We've been studying the occurrence, fate, and treatment of 1,4-dioxane in both water and wastewater systems and how it contributes to the pollution of our precious resource, our groundwater in Long Island. As many of you know, 1,4-dioxane is an emerging contaminant and it's a possible human carcinogen. It's very widely used in industrial processes as a solvent, and it is classified as a high production volume chemical, meaning it's used and produced in excess of 1 million pounds per year in the US. It is especially particularly concerning to Long Island residents because very high levels of 1,4-dioxane has been detected in our groundwater. And as a matter of fact, the highest concentration of 1,4-dioxane across the country has been detected in Long Island at levels 100 times higher than the US Environmental Protection Agency's cancer risk guideline level. 1,4-dioxane is a very persistent chemical. It does not easily degrade in the environment. As a result, conventional water and wastewater treatment processes do not remove 1,4-dioxane from contaminated water. In addition to industrial sources, and as Adrian mentioned, several household products and personal care products contain very high levels of 1,4-dioxane that leads to a suggestion that the use of these products could contribute to the ongoing pollution of 1,4-dioxane in our groundwater systems. Our center recently completed a 1-year study that actually confirmed this suspicion. I'm going to share a visual at this point to summarize this result. All right, so what we did in this study is we collected tap water samples and septic tank effluent from residences, multiple residences located in Suffolk County, Long Island, and we monitored these samples for 1,4-dioxane over a period of 1 year. And what our results show is that the concentration of 1,4-dioxane in the wastewater that's leaving the homes is on average 10 times higher than the tap water concentration of 1,4-dioxane. This finding is important because what it suggests is household activities, particularly the use of products containing 1,4-dioxane, is significantly contributing to 1,4-dioxane in the sewage leaving the homes, which ultimately ends up polluting our groundwater environment. These results were recently published in a journal article in the Science of the Total Environment journal, and the link to this paper is available in the slide, at the bottom of the slide. Of course, I need to acknowledge the hardworking researchers behind this important research finding, without which we couldn't have completed the study. In addition to this finding, we also found other new findings of how we could remove 1,4-dioxane, and I'd like to invite Dr. Gobler to talk more about these other findings.
Thank you, Arjun. Okay. So at the Center for Clean Water Technology, our mission is to harness science to engineer clean water for the protection of both public health and the environment in New York and beyond. And I'm just gonna backtrack slightly from the 1,4-dioxane to just remind everybody of the nitrogen crisis on Long Island. And that as the population of Long Island, and specifically Suffolk County, has grown, so is the level of nitrogen in our groundwater, which is our drinking water supply. And many studies, some done by the Nature Conservancy, but others done by scientists from the Marine Biological Lab in Cape Cod, myself, Suffolk County, Nassau County, others have all come to the same conclusion, that rising level of nitrogen in our groundwater is coming from wastewater. And in Suffolk County, it's specifically coming from on-site systems. 70% of the homes in Suffolk County are not connected to sewage treatment plants, and that's leading to the contamination of our groundwater and our drinking water with nitrogen. And from an ecological point of view, we know that when that groundwater discharges into surface waters, it leads to all sorts of water quality impairments, harmful algal blooms, and low oxygen conditions, from Montauk all the way into New York City. When the center was founded in 2015, we came up with a very specific goal with regards to wastewater, and that is to design and to develop and implement an on-site wastewater system that would fit our goal of 10-20-30. And that is to have a system that gets nitrogen down below 10 milligrams per liter, the US EPA standard for drinking water, that would cost less than $20,000 to install and would have a lifespan of more than 30 years. And so the first efforts of the center towards that end have been something we call nitrogen removing biofilters, which are meant to connect to people's existing septic systems. And very simply, they're comprised of a layer of sand that's above a layer of sand with wood chips. And the wastewater is distributed to the system via, very simply, perforated PVC pipe and a dosing pump. So these are all natural products. These products are found on Long Island. We're using Long Island sand and Long Island wood chips. And I won't give a chemistry lesson, but I'll just very simply say that the two layers are occur in that order so that we can promote what's called nitrification and denitrification and the removal of nitrogen. We have three versions of these systems. One shown here has a liner across the bottom of that lower layer. We have another one that is unlined, and a third in which the sand layer then connects to a tank filled with wood chips. And in this case, we're able to access the wood chips and remove them and change them as needed. So a second paper we're here to talk about today was also just published this month, like the one Dr. Venkatesan just referred to. This was published in the Journal of Ecological Engineering, and the title is pretty self-explanatory, removing 80 to 90% of nitrogen and organic contaminants with 3 distinct passive lignocellulose-based on-site septic systems receiving municipal and residential wastewater. So this is about the NRBs. Just would like to take a moment to say that publishing within international peer-reviewed journals is really the gold standard for science. So these publications are not very simply what we're finding and what we think, but they're going through a review process where we're having multiple reviewers from around the world critically look at the science and then deciding, is this valid science? Is this publishable science? So this is the highest standard to strive towards as a scientist. And that's what the center will continually do. We published actually 8 papers in international peer-reviewed journals in 2020, and we're going to hope to continue that pace or beyond in 2021. But getting into the details of our findings, our NRB systems were installed first in Massachusetts, and over 3 years, they continually reduced nitrogen below our standard of 10 milligrams per liter. Now, I'll note in Suffolk County, the standard for an innovative and alternative septic system is 19 milligrams per liter. So we've set the bar higher for ourselves, and we've cleared the bar. This is showing the data for systems installed in Massachusetts. And now here I'm showing the 3 different designs, the wastewater coming in and going out of homes in Suffolk County. And again, we've cleared the bar. The average is the X there, and in all cases, we're achieving less than the 19 milligrams per liter, in most cases at or around 10 milligrams per liter. Now, certainly nitrogen is a huge concern with regards to the environment and public health, but there are many other things in wastewater we do not want to be drinking. And so within our study also, you can see this table here of more than 2 dozen organic contaminants, drugs, pharmaceuticals, personal care products, and the percent removal by our NRB systems. And I'll say in all cases, the removal rates are at or better than, in most cases better than, what you'd see for a sewage treatment plant. And I'd like to, in advance, congratulate Tricia Clyde. She's defending her doctoral dissertation on this topic this afternoon, and was the person who was really instrumental in generating this data. We're also removing most of the phosphorus out of wastewater and nearly all of the pathogens. And then circling back to what Arjun's finding is, on the paper he referenced, we've put on the drinking water end of the center, has spent a lot of time trying to figure out how do we get 1,4-dioxane out of our drinking water supply. You cannot filter it. You cannot bubble it out of the water. You cannot use granulated activated carbon. You need to use a very expensive process known as advanced oxidation processes. But what Dr. Venkatesan has shown in that paper is that our NRBs are actually removing nearly 60% of the 1,4-dioxane. So he showed you how the 1,4-dioxane is being enriched in in wastewater coming out of homes. But if you attach an NRB to the end of that wastewater, we're reducing it by more than 60%. And most importantly, in all cases, the effluent out of our NRBs is less than 1 microgram per liter. That is the New York State drinking water standard. So the water is coming in above the standard, it's going through the NRB, and it's coming out below the standard. And in exciting news with regards to our NRBs, this is a letter we got from Suffolk County. These systems have passed out of the experimental phase of testing in Suffolk County and are entering now the piloting phase. And so that letter was dated January 29th. We are on the verge of installing our, having 8 NRBs installed. We believe that's going to be done next month. We need to have then a 3-month waiting period followed by 12 months of testing. So we anticipate by June of 2022, these systems will be available for widespread installation all across Suffolk County. That's for our unlined system, and we believe our lined and box systems will follow soon thereafter. So summarizing everything you've heard today, we're announcing the first published scientific study to demonstrate that household products are causing 1,4-dioxane contamination of our groundwater supply. the first study to demonstrate that our NRBs are removing between 80 and 90% of nitrogen, drugs, pharmaceuticals, personal care products, phosphorus, and pathogens. The first study to demonstrate significant removal of 1,4-dioxane from wastewater with NRBs or any septic system. And then finally, that we are now in piloting stage and moving towards provisional approval of these NRBs. So with that, we will conclude the presentation phase of the press conference. And if there are any questions, we would be happy to answer those now. And we're a small and intimate enough group that if people would simply like to unmute or raise their hand, they can ask their question. Danielle, is that you?
Yeah, that's me behind the mask. Dave Garden, my cameraman. We're sitting in Manorville with two residents that have no public water, and they have cesspools. And we wanted to, of course, make this story deal with the real people who are really dealing with this. I have many questions, but number one, how expensive do we see the NRB costing?
So that's a great question. And so again, our goal is 20,000, and we think by the time we get to provisional stage, the simplest installations will be at about that level. Each home is a little different because in some cases, if you have a very small yard or things that need to be moved, it may cost more. But in very promising news, in many towns, these installations can be done for almost free. So for example, currently there are state grants to install these systems, county grants to install these systems, and then within the towns of Southampton and East Hampton, there's town grants to install these systems. And in many cases, these grant funds can be at the $20,000 or $30,000 level. So it's very little out of pocket cost for the homeowners. I'll just ask Kevin McDonald, is there anything you'd like to offer beyond that?
You're muted, Kevin. Kevin, you're muted. For God's sakes, unmute.
I'm sorry. So the only thing I would add is this is clearly a challenge, and some of correcting this is going to take time, as it has. And the other comparison is some of these systems by themselves are not necessarily inexpensive. The alternative is sometimes even worse, in that you continue to drink contaminated water, or if some of these areas were to be sewered, it could take as much as 5 to 10 years for that to actually happen, and the cost would be 4 or 5 times the cost of the installation of an advanced treatment system or an NRB, as Dr. Gobler just referenced. So, we're at an inflection point in change, and it's a difficult time, but we're heading in the better direction than we've been. And Adrian, if you wanted to add anything.
Yeah, I'll just add, look, this is great news. We just heard that now there'll be a system that to start out would be $20,000. Just the state grants and county grants are going to be $20,000. So if someone is, after the 3 months of testing, if someone is looking for, a system to replace their old failing septic and cesspool, they basically, if you live in Suffolk County, can get this for free. Mm-hmm. So that's great news. This doesn't apply, I don't think, and Dr. Gobler and his team can address this, to the water suppliers who have to filter it out. But this applies to, how do we prevent additional contamination of 1,4-dioxane from continuing to go into our groundwater supply? And that was one of the things we were most concerned about. We just don't want to filter out the legacy waste that's there. We want to prevent pollution before it gets into the groundwater. And Stony Brook has found one significant tool to do that.
Dr. Gobler and your team, I just want to say, I should have said this right off the bat. Congratulations, because
thank you.
This is amazing, and this is, as you know, something I've been covering And to go from that very challenging way to remove 1,4-dioxane to basically, I mean, I'm saying basically, but I know it's not basic, wood chips is, you know, just a wonderful thing. I'm wondering, is there any idea of how to put the wood chip idea, and again, I'm being very basic here, on the other end of the spectrum where the water companies can start using that idea, filtering the drinking water for our public?
I'm going to defer that question to Arjun Venkatesan because he actually has led the effort with all the water suppliers to get out the 1,4-dioxane. Arjun?
Yeah, definitely. So the technology that we are using, which is a nitrogen removing biofilters, utilize microorganisms to break down these contaminants. And you really don't want microorganisms in your drinking water. So typically, the water providers try to stay away from employing microorganisms to treat these persistent chemicals, because then you're left with water with a lot of microbial activity and you need to do more treatment on it. It's better. So that's the reason this treatment works great for on-site wastewater, because you already have all these microorganisms, viruses, and other nasty stuff, and it works great in preventing the pollution from entering into the groundwater.
So just to follow up on Danielle's excellent question there, you don't think that this is applicable to replace the AOP systems?
Not at this stage, no, because there are a couple of constraints here. Like our NRBs require a long residence time to treat the wastewater. So we typically have like 2 to 3 days, and Chris can correct me if I'm wrong. And it requires a lot of organics in your water for the microorganisms to grow. So typically the groundwater that it's already filtered out in the ground, and when you treat it, you don't have these enough organics for the system to sustain and treat the contaminants present in groundwater. So there are a lot of challenging and operational challenges. I wouldn't say no. There might be opportunities in developing this system for drinking water application, but not at this moment, I would say.
And the reason we're asking these questions is because, well, first of all, just maybe 2 weeks now, residents across Long Island received notification from their water provider that there is 1,4-dioxane above the federal standards, state standards, as well as PFAS and PFOA. So, and it's been kind of an interesting story because all of a sudden people realized, wait a minute, my water's contaminated. And many residents were really shocked to find that out when they got the letters from the companies. So that's kind of on our mind because, you know, all of Long Island's in a bit of an uproar about their water quality. So, and I know this is not what this is about, but I know this is the back end of it, which is a great thing. But we're, you know, I guess Long Islanders are hoping down the line there'll be something for their.
I will just say on the, you know, the whole half of the center that works on drinking water, there's really a laser focus on only 2 things: getting 1,4-dioxane out of our water supply and getting PFAS compounds out of our water supply. So, you know, we know at least for public water that the AOP process, you know, Dr. Venkatesan's demonstrated works well for that. And we're working on figuring out the best ways for getting all PFAS compounds out of water supplies as well. Certainly tricky for people who have their own wells. I know I had one for 12 years and only actually in the last year got a public water supply. So
I just want to provide you some information, Chris, that Danielle's referring to, is that there are, as much as we know, over 21 different water supplies on Long Island that received a deferral from the state of New York to actually have live up to the drinking water standards for PFOA, PFOS, and 1,4-dioxane. As part of that deferral, they're required to send letters to their customers saying that the drinking water is above standards for these chemicals, and it will be so for the next 2 years. So we've been getting calls and questions and copies of the letters also, people saying, what is going on? I'm going to drink contaminated water for 2 years? And the answer is yes.
The other thing, and again, this is relevant, but not exactly what we're talking about, but I'm sitting with two homeowners here in Manorville who not only they have traditional cesspool sanitation system, and they have wells that is their water. So they have a double whammy. And Adrian, knows these folks very well, but they're just kind of like, what do we do? And they're in Manorville. So I know that communities that are near our surface water are afforded, a greater opportunity maybe to get these filtration systems, but they're kind of smack in the middle of the island, and is there help for them?
I don't think the Suffolk County upgrading program discriminates by location. So I think they would be, they can apply and get the grants from Suffolk County to upgrade their household systems.
But I think the point is extremely well taken from Danielle, that people who have a septic system with the private well right on the property have an increased risk based on your report of having 1,4-dioxane in their drinking water. So I think that's a significant point. It's not a good thing. It's not good news to hear. But based on the data, I guess I should ask this in form of a question to Dr. Gobler. Is that a fair statement?
I think possibly. It's going to be side by side, and it's really a question of a lot of we would literally need to do a groundwater study there to understand the flow direction of the water, which can change by season and such. But in general, however, I will say that when homes are put in, it's meant to be that the wells are placed such that they're not certainly downstream of the on-site system for one home, and I think they try to consider that for other homes as well. But there's no doubt it's certainly a heightened risk.
Listen, and I'm not trying to rain on your parade because I think this is so exciting. I really,
Sure, yeah.
It's a wonderful announcement. So I don't want you to think that.
No, not at all. And I think if anything, that situation is exactly why we need to have alternative septic systems installed as soon as possible.
Exactly.
Do you know if there's been for the other IA systems that have been approved or being studied by Suffolk County, have they been looking at the data for 1,4-dioxane, and have they found that those systems remove 1,4-dioxane?
Yeah, there's no such data presently. And I could let Arjun comment, but part of the reason the microbes that are doing the work for us are attached to the sand bed of our NRBs. And so absent a sand bed for those systems, it may be less likely that they remove the 1,4-dioxane. That sand bed, extended residence time, that's why you don't get removal really in a sewage treatment plant. So Arjun, would you agree with that or add anything on that?
No, I agree with Chris's just summary right now. So what our work found was the performance of NRBs to remove 1,4-dioxane was much better than conventional wastewater treatment systems, which also employ microorganisms to degrade contaminants. So we think like the operational and the design that we use in NRBs is actually supporting the microorganisms that are capable of degrading 1,4-dioxane. And that is probably not seen in conventional wastewater systems. I'm saying probably because we haven't tested those samples for these microorganisms, but we have in the study, however, confirmed that these microorganisms live and survive in our NRBs that can feed on 1,4-dioxane.
And so to follow up on the earlier question about the drinking water and whether this technology could be applied to drinking water, is that something that you guys plan to study in the future, or is that not
At this moment, we haven't thought about that. Maybe we should after these questions, I guess.
Thank you.
All right, well, thank you very much.
Other questions from anyone?
Yeah. No, I think we're good. And this is for 2022 of June.
We anticipate ours will be approved by Suffolk County for provisional general use June 2022. That's correct.
And I guess it's too soon to have like people apply for it and that kind of thing. You have to wait for.
Well, that's a very good question. It does take a while to go through the county process. I haven't really thought about when people might start designing a system for approval. Maybe at the start of 2022 would be the right time.
Okay, and Chris, Dr. Goldberg, I remember when you unveiled this first system at the Nature Conservancy in Huntington. So how many years has this been in the making? This.
I think our first installation was 2017. Frank, can you confirm then?
It was actually 2018 in Suffolk.
2018. Okay.
Yes.
And that was at the Nature Conservancy in Huntington when we.
One of the first few was there.
Yeah, right. Okay, good. So just so I have like a time frame on that.
Sure.
All right, guys. Well, thank you very much. We appreciate it. The plight of some of the homeowners across Suffolk County, especially, is really dire. And anything that any of you can do to help them, and I know you have. There are people that cannot get public water because of the cost. Trying to get the Navy to bring public water in, but that's kind of been a dead end.
No. That did not hit a dead end yet. We're still fighting on that, Danielle. That is not at a dead end. It might be at a little cul-de-sac, but it's not at a dead end.
Okay. All right.
Adriana, you better not say it's at a dead end. I'll
Okay.
tell you.
Ron, okay, good. Ron,
Stay
all
tuned.
right. Sorry to say that. I didn't mean it exactly that way.
Okay.
But anyway, yeah. So thank you for all that you're doing to clean Long Island's water. We appreciate it.
David, any further questions from you?
No, might bug you later.
Okay, all right.
Actually, however, I do have a follow-up comment for David's question regarding using this technology for drinking water. I forgot to mention that one of the research that the center is doing is isolating these microorganisms that is capable of degrading 1,4-dioxane. And we eventually want to coat the GAC filters or the activated carbon filters that we use for drinking water treatment with these microorganisms to see if we can remove dioxin directly with filtration. So that's one of the applications that we are researching now, and Assistant Professor Dr. Shinwei Mao is leading that effort in the center.
And I want to add one other comment too that no one raised, but the DEC is right now engaged in crafting the regulations to phase out 1,4-dioxane from products. They recently held meetings with stakeholders, which included not only environmental and public health advocates, but also a lot of the businesses, Dow Chemical, Procter & Gamble, that would have to comply with the law. And this research adds a lot of substance and meaning about why we need to get this out of products during the timeline in the legislation. A lot of the fuel will be taken out of their arguments to have a lot of products exempt and to put the timeline back. So this is excessively helpful in getting the good policy implemented in the right timeline. So thank you again.
Thank you. And any other questions from anyone? WSHU?
Thank you all.
Okay.
Nothing
Thank
further, we
you.
will close. I thank everyone for their interest and for attending, and we look forward to bringing you more good news in the future. So thank you.